Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." Sinus rhythm, rate 72, normal axis, normal cure restoration. You can see that we have anterolateral deep symmetrical ST depression only sparing V1. And there is also relatively poor R wave progression. You can see that the R waves progress by the time you reach V4, but they're not really progressing by V3. There is also some inferior T-wave inversion. This is an LAD syndrome ECG. It's the left anterior descending artery we suspect is involved, and we know this because occluding the proximal LAD briefly will cause a small amount of damage, and this deep symmetrical T-wave inversion telling us all of this territory is involved. This is important because it makes the patient high risk, and we should consider urgent cardiac catheterization plus or minus intervention. This sort of a patient, the T-waves will evolve, and so in a month's time, this ECG may have normalized. In fact, the timing is critical. In about 50% of patients, when they first arrive, they have a normal ECG, and this is this patient's ECG on arrival. You can see that there's, if anything, more loss of R wave in the anterior leads, but there is not much else here. It's not the best quality ECG, my apologies, but there's not really anything else here to show evidence of ischemia, certainly none of that T-wave inversion. The next day, the ECG, we see this widespread T-wave inversion, but you might not immediately say that that was an LAD syndrome ECG if you saw it for the first time. We look for the deep arrowhead type ST T-wave inversion, but then another day later this develops, telling us clearly that it's a LAD syndrome ECG. Thanks for watching.